It does remain a relatively rare event. These severe hepatitises.
At least 10 confirmed cases in Canada, including one in Quebec, of acute severe hepatitis in children. Hepatitis is an inflammation of the liver, and depending on the cause, the Public Health Agency of Canada says the disease can be sudden and progress to liver failure over a few days to weeks. Since April, the World Health Organization has reported an increase of the disease with hundreds in countries around the world.
First, it's important to understand that all of these children have been investigated for the usual suspects of hepatitis, so hepatitis A, B, C, and E, and have come up negative. There are other viruses that occasionally can cause hepatitis, and so far we haven't seen those viruses come up as being linked to these cases.
The cause of the illness is not known at the moment, but many hypotheses are being explored, including adenovirus, which is a common virus that typically causes cold or flu-like illness or gastroenteritis, says the health agency. But what are the symptoms of acute severe hepatitis in children?
Could be loss of appetite with some fever, nausea, vomiting, diarrhea are often associated with it as well. But the worrying signs would be if you see signs of jaundice, that is to say a yellowing of the skin, a yellowing of the whites of the eyes, a dark colored urine, and pale stools, accompanied by lethargy and generally not doing well.
According to the WHO, side effects from the COVID-19 vaccines are not suspected since most children affected were too young and not inoculated. COVID-19 itself, however, may be behind the disease, according to a report from medRxiv, stating that children are at an increased risk for liver dysfunction after having COVID. Some experts say although not much is known about the disease and its roots, precautions should be taken, like wearing a mask.
You have this outbreak of hepatitis that is life-threatening and for which we don't entirely know what's going on, but it could very well be related to COVID in unvaccinated children. You kind of put the pieces together and say maybe the masks should be kept in place, at least in indoor activities, including schools.
At least 3 cases in Alberta, 2 in Manitoba, 4 in Ontario, and 1 in Quebec, all who were children between 1 and 13 years old, each hospitalized, and 2 required a liver transplant. In the United States, officials from the Centers for Disease Control and Prevention confirmed 6 deaths linked to acute severe hepatitis as of May 20th. No deaths have been confirmed in Canada.
Right now, we're really at the stage where public health officials across the world are trying to collect as much data as possible, to do it in as systematic a way as possible, to try and figure out what it might be the potential causes of this severe, but thankfully very rare manifestation.
In Montreal, Pamela Pagano, City News.